Hello, Miss Smith. How are you today? It's Olivia. I'm going to be your nurse today, and I'm coming to give you your 8 a.m. medication. Is that all right? All right, great. Thank you. I'm going to wash my hands. All right. And I'm going to verify your first and last name and your date of birth, okay? So it's, can I see your armband, your identifier? Okay, I'm gonna grab this from here. It's James Smith, 1962. Great. Let's see this right here. Before we get started, Miss Smith, you have an allergy to morphine and penicillin. That's correct, right? I'm going to take a look at your armband. You have an allergy armband, so I'm going to look at that. Great, that's correct. It says those two drugs. All right, so we can get started now. The first thing that I'm going to give you is your fentanyl patch, and it is 50 micrograms. I'm gonna place it on an area where you haven't had the patch placed before, and it's been previously washed with soap and water already. So before I administer this medication, I would like to know your pain scale. So we're gonna rate the pain scale from 0 being no pain at all, 10 being the worst pain you've ever had. All right, you're at a 7. Okay, so we're gonna go ahead and take this medication. I'm going to administer this medication to you. I'm going to put this patch on your arm. I'm going to initial the patch. I'm going to write the dates. And then I am going to put the time. 8 a.m. Great. All right. I'm gonna put this right here. Make sure that is nice and secure on your arm. All right, and that was 50 micrograms of your fentanyl. All right, so your next couple of medications, we're looking at the MAR as well. So we just, that was the fentanyl, 50 micrograms. And I'm going to enter in where I have placed it on your left arm at 8 a.m. All right, great. All right, so now I am going to give you your Coumadin. That is your blood thinner. Before giving your Coumadin, we've already done your PT. And I've assessed you for bleeding and hemorrhaging. Any signs of that? So your Coumadin is 10. I'm giving you 10 milligrams. Each pill is worth 5 milligrams each as well. Right. Great. All right. Following that up with water. Great. Next thing I'm going to give you is the Digoxin. Your Digoxin is your hypertension medication. I will be giving you a 0.25 milligrams of Digoxin. And we have assessed your heart rate and your blood pressure beforehand. Great. Follow that up with some water. And the next medication that you're going to get is your Metoprolol. And that is also your hypertension medication. We have assessed your blood pressure and your heart rate. And also we made sure that you had your meal before this. So we had talked about either having your meal before or having your meal within that same time period, before or during. with your Metoprolol. So this will help with your angina as well, and that's any pain that you're having in your heart and chest area, and as well as your hypertension. So I'm gonna give you this. Great. And then drink it with water. Great. All right, your final pill that you're gonna get. And for the Metoprolol, we gave you had 25 milligrams of the Metoprolol, by the way. And we're going to do the Doxycycline. And you're getting 100 milligrams, and all these medications were by mouth. Before we did the Doxycycline, that's your antibiotic. We did do your white blood cell lab today. So we're gonna be giving you your antibiotic by mouth. Okay. And your water. Perfect. All right, so with these medications, we just want to make sure that we are monitoring for any type of dizziness upon standing, any type of nausea, vomiting, constipation, or any type of diarrhea. We want to make sure that you're not operating any motor vehicles if you're having any type of that dizziness, or if you're having any type of effects that cause lethargy or you to be tired, and or operating any heavy material. And then we also talked about those meals during or after for Metoprolol. And because you have your Coumadin, which is your blood thinner, we want to make sure that that we're monitoring you for any type of signs of bruising or any type of hemorrhaging that you've never had, or any type of unusual bleeding. All right, so I'm gonna document all your medications. All right, so those will be the things that we're assessing for. I'm gonna continue to come back and monitor you and come back and check your pain scale and make sure that everything is going all right with your pain and that you're no longer having any more pain. All right, great. I'm going to remove my gloves. Going to perform hand hygiene, and then I'm going to leave you with the call light. All right, yes ma'am. Ms. Smith, just let me know if there's anything that you need. All right, great. Thank you. Have a great day.